PBS Utah presents the Governor's Monthly News Conference, an exchange between Utah reporters and Governor Spencer Cox.
Ladies and gentlemen, welcome. It's great to be with you again. It's hard to believe that it's been a month since we were last together, but we have some important announcements today. I'm going to spend some time at the beginning talking about a coronavirus update as well as a vaccine update, and then I'm happy to take questions. So, first of all, we have made incredible progress over the past month and especially over the past week when it comes to vaccinating all of Utah's adults age 70 and over. In fact, as of this morning, we have vaccinated approximately 62% of those that are 70 and over with their first doses. Some counties are actually pushing the high 60s and low 70s, which we know there's a spot where we're seeing a softening, and that is already happening as we reach the end of those who want to get the vaccine who are age 70 and over. And so as a result of that, I am very excited to announce that as we continue to see our weekly allocations of doses increase, that I am announcing that as of right now, immediately, Utah adults ages 65 to 69 are now eligible to receive the vaccine. That being said, some counties have more doses available than others right now, so it will still be, we encourage patience. There will be some counties where it's harder to get an appointment right now. We were scheduling to do this on March 1st, but we are moving it up, so we always want demand to outpace supply. That's how we make sure that every vaccine is being used, that we always have vaccines in arms instead of on shelves. It's important to note that, again, all of our vaccine providers should now accept anyone 65 years and older. Appointment availability will vary throughout the state, but they're working hard to get more and more people through every day. You can visit coronavirus.utah.gov/vaccine to find out more information on how to schedule an appointment. And I can't emphasize this enough. We will ask for your continued patience, as this will flood phone lines and servers, and more people will be trying to sign up. As those slots become available, those 65 and over will be able to get those. If you can't find an appointment immediately, keep trying, and eventually you will get your turn. Now, I announced a couple weeks ago that people with certain underlying medical conditions would also soon be eligible to receive that vaccine. That date was also March 1st. That date will continue to be March 1st. So those with those underlying health conditions, there's a list again at coronavirus.utah.gov. You can go in there and see every underlying comorbidity or health condition and who qualifies for those. You will still qualify on March 1st to do that. This helps us in a couple ways. One, again, it makes sure we're able to fill all appointments with those 65 and over. It also gives us a little bit of time. Those two categories combined, 65 and older and underlying health conditions, was about 400,000 people. By splitting it up this way, we'll be able to move people through a little more easily, and again, make sure that starting on March 1st, that those with those comorbidities will qualify. So I hope that's clear to everyone. Again, we'll have some time for questions. Just a couple other updates that I think are important. Our case counts and percent positivity and hospitalizations are all decreasing. This is very, very good news for our state. They're still high, but much lower than our peaks of December and early January, and trending in the right direction. In fact, our numbers look a lot more like they looked in September, which is good news, but we would rather they look like they did in July and March and April. So we're working to get those down. We've conducted 3.6 million tests and really want to highlight that testing is still the very best way to identify positive cases so that people can isolate and stop transmitting the virus to others. So if you do have any symptoms, please get a test. Again, coronavirus.utah.gov, there is a list of places you can get a test, but you don't need to have symptoms to get a test. If you've been in close contact with anyone who has contracted the virus, you can get tested. We have have testing happening in lots of different places for lots of different reasons, and we have tests available. So please don't hesitate to get tested. In our transmission index this week, 6 counties have improved certain key measures and have moved from high to moderate transmission. We now have 8 counties in moderate and 5 counties in low. It's important to note that these 6 counties would have moved to moderate even if we had not changed the transmission index last week. And we made that change based on percent positivity. We're now measuring 2 distinct ways of percent positivity. We talked about that in some of our past measures, but you can learn more about that as well at coronavirus.utah.gov. Also important to note, we are seeing 91% of our long-term care facility residents getting vaccinated. That's a really important number because the highest amount of deaths have come from our long-term care facilities, about 40%. It's been a while since I've checked that number, but I know it's around 40%. And so getting 91% of them vaccinated is a really, really big deal. Again, having close to 60% or over 60% of those aged 70 and older getting vaccinated is a big deal because they make up about 70% of the total deaths in our state, about 73%. And now going to 65, that's another 4% of the deaths, just 65 to 69, which is the next highest category. So as you can see, we're methodically, via vaccination, targeting those who are most at risk, which will cut down on hospitalizations and deaths and allow us to get back to normal more quickly. I would also note that of the 39 states that we've been able to find that are listing the deaths within their long-term care facilities, Utah has the lowest mortality rate, which is just again, really, really positive news, and we're heading in a great direction there. All of that being said, and if Dr. Dunn were here today, she would tell you, and she would have me tell you, that it is not a good time to let up on the things that keep us safe and protect us. It will continue to drive down those rates and hospitalizations and deaths, including especially mask wearing. The COVID-19 variants that we're starting to see do pose a real threat, and we still have a way to go before we can remove that mandate. We're getting closer every day, and we'll continue to look very closely at those measures and metrics, and again, working with the legislature on those changes as they become more viable, as we get control of this virus and more people get vaccinated. Finally, I'll just conclude with some numbers. We now have administered 563,608 doses of the virus. That includes first and second doses. A week ago today, our total doses administered was 462,000, and that's a weekly increase of almost 101,000 doses, which again is remarkable in some numbers we've never seen in the history of our state in such a short amount of time. So far, our single dose administration record was 24,618 on February 11th, and we are still using every vaccine within 7 days of its receipt, which was the goal when we started, our administration started the first week in January. We're very pleased with where we are. We're excited now to open this up to 65 and older, and we're excited to see the results of all these vaccinations. With that, we're ready to take some questions.
Governor, do you want anything changed in the current version of the bill that came out this week to limit executive powers during a long-term emergency?
So we are working very closely with the legislature on this limitation, as it's been said, on the powers of local governments or of the executive branch of state government to issue emergency orders. I think it's really important to point out a couple things with this. First of all, the legislature has the power to make these changes. There's no question about that. That is not in debate. The idea philosophically behind emergency powers are this. The legislative branch gives their power to the executive because the nature of a legislative branch is that it is very difficult to bring people together in an emergency and to act quickly. There's nothing quick about what happens in the legislature, although we do have a 45-day session and a lot happens in 45 days. Some, like me, would argue that too much happens within those 45 days, but it's a very, very important function, and it is their function. So what they're saying is, during an emergency, we're going to willingly give away the legislative branch's powers to the executive branch to make decisions unilaterally to protect the safety of the people of our state or of an individual community. That balance is very important and very critical, and I recognize that power that I have comes directly from the legislature. What I've encouraged them all along is to not overreact to something that happens every 100 years. We have made mistakes during this pandemic, for sure. I would argue that one of the mistakes that we made was not communicating better with the legislature about changes that were happening. We would often communicate with legislative leadership, but as any member of the legislature will tell you, that legislative leadership is not the legislature. And we have, over the past couple months, done a much better job of that. So I have appeared directly, which rarely happens with any of my predecessors. I've gone directly to legislative bodies to talk to them about what we're doing. I did it just a couple weeks ago, meeting with the majority caucuses and the minority caucuses of both the Senate and the House. I'm doing it again next week, and so we are improving that communication. We have been directly engaged in negotiations on the emergency powers bill. There have been lots of changes made at our request. We will continue those negotiations. We'll do those privately, and when the final version of that bill comes out, we'll let you know whether we support it or not. I think that's the better way to negotiate these, and so we will continue to do that. We respect the legislature and what they're attempting to do here. And by the way, I have to just be honest. It would be much easier if the legislature would do more of this. There's this belief out there that governors love executive orders and governors love emergency powers and governors love making all these decisions. And let me categorically tell you that the last year, and if Governor Herbert were here, he would tell you, was one of the worst years of his life. It was one of the worst years of my life. It was one of the worst years of everyone's lives here in the state of Utah. And we had to make decisions that no governor should ever have to make about saving lives and saving livelihoods. Nobody relishes this. Nobody enjoys it. And I will also say, and I will remind the legislature, that they now have the ability to call themselves into session at any time and overrule any order that has been done from the very beginning. They have that authority now. They don't need a bill to change that. And I will also note that they failed to exercise that authority at almost every turn because they didn't want to make these decisions either. And so it's a really, really difficult position to be in. And so we will work together. I do think that the emergency order, the power that exists now, never contemplated emergencies that lasted for a year. That was not contemplated. It's not something we really thought of. Emergencies are something that happen in a week or a month or two, right? If we have wildfires, we have floods, we have earthquakes. Those are the things we normally thought of. And so I agree, and I've said from the beginning that we should examine this and make it better for both the executive branch and the legislative branch to function over the course of something that lasts this long.
A quick follow-up. I mean, Governor, 30 days seems like a blip of time when you think about all that's changed over the course of the pandemic. Is that time limit in that bill a safe limit on executive powers? Well,
those are discussions, again, that we're still having. 30 days is it seems like a short amount of time right now, but I will tell you, in March, 30 days seemed like a year. And so this is the type of thing, though, where now, especially with the tools we have, and let me be clear, that's one of the things that has changed, right? 10 years ago, in a pandemic, we could not have safely brought the legislature together. And that would have made it incredibly difficult and incredibly damaging, right? We would have been putting their health at risk, and that would not be advisable. And so now we have, though, electronic tools that do allow them to come together and meet and to make decisions and to do what legislators are supposed to do. And so whether 30 days is the right number or 60 days is the right number, there's a number in there, and we'll continue to work to figure out which is the right one.
Back on vaccinations, Governor, in terms of the 65 plus and the folks with underlying health conditions, do you have an estimate on how long they'll take? And people always want to know what's next. I know you haven't announced the next groups, but what are you considering?
Yeah, so again, it's really just a math issue for us. So we know that, and I apologize, I should have these numbers top of mind, but it's about 130,000 people ages 65 to 69. Okay, and so we're now getting about 45,000 first doses of vaccine a week, right? So you can start to do the math there a little bit. We know 100% of those they're not going to choose to get the vaccine. So is it 65, 70% somewhere in there? How long does it take you to reach that? Now we've already announced the next phase, which are those underlying comorbidities. There's about 220,000, I want to say, in that category. So a really big category. We start them on March 1st now, but we're getting more doses every week, and in March we're going to keep getting significant increases, we've been told, by the Biden administration, especially if Johnson & Johnson comes online, which we should know probably in the next week and a half, I think, somewhere in there to 2 weeks. And so we anticipate that we will see, we'll be able to go through those 65 to 69 and those comorbidities now into mid to March, late March, somewhere in there, right, depending on the amount of doses. And what I will tell you, you will see is we will keep doing age-based categories. So we'll go from 65, next it will be 60 to 64, right, and then 55 to 59. And we will also, and we're working with the experts at the health department to layer in the rest of the comorbidities, those underlying health conditions that aren't as serious as this first wave, but are still serious. And we're doing a complete risk assessment. So we really are looking at risk of death and hospitalization, and that's how we're making these decisions. So there is a point where someone who is younger with one of these underlying health conditions looks like a 59-year-old, right? When you look at the risk categories in Utah and how many people have died and been hospitalized. And so we will elevate those at the right level, and that's what people can expect. We do still expect that the numbers we've been talking about, Pfizer and Moderna agreed to have 200 million doses in the United States, so 100 million first doses by the end of March. And we've been told that they are still on track to meet those obligations. Johnson & Johnson, I believe, has guaranteed 100 million by the 1st of June. And so if you just start to look at how those lay out, we really do anticipate that into April and May, into May, that every adult who wants a vaccine should be eligible for a vaccine unless things change. So we feel really good about that. The only thing that could slow this up is, again, the amount of vaccines being produced if something happens in the production cycle or in the delivery cycle. We did have one little, not little, it's a big issue in shipments with the terrible weather in the Midwest and the South, that we had some shipments that were delayed because of trucks couldn't get out and planes getting de-iced and slowed down. So a St. George shipment was delayed, but that will be made up, we're told, very quickly. It's just getting the planes out and getting them here. But those are the types of things that could slow that down. However, again, from all the information we're receiving, we're very confident at that May timeline. Please.
Good morning, Governor Cox. So we know that President Joe Biden will be presenting any minute an immigration reform bill. According to him, that could help a lot of immigrants in the country. Is that something that you will be welcome to the immigrants in the state of Utah, or do you have any concerns about that?
Sure. So obviously I haven't seen the bill, so I don't know what is in that bill. But what I can say is that Utah has a history of working collaboratively on immigration issues. It's now been, I want to say maybe 9 years ago, it was before I was lieutenant governor, that the state passed comprehensive immigration reform. Now, unfortunately, that immigration reform was never implemented because the Obama administration refused to allow us to implement that. And I will say that neither did the Trump administration. This is not a partisan statement, but the federal government has not allowed us to do that, unfortunately. But I will also say I've always been really amazed and I guess disturbed, confused at how we haven't been able to solve the immigration problem. It may surprise people, but immigration really isn't one of the most controversial issues. Now, politicians have made it controversial, but when you look at polling of average voters, most of them agree. And the two things that they agree on, even Republicans, and this will surprise people, but most people agree that we should make legal immigration easier, that we should fix legal immigration. Most people aren't anti-immigrant, they're anti-legal immigrant, but also recognize that there are problems with the immigration system. And so they want to secure the border, they want to fix legal immigration, and then they want to make it easier for people that are here to gain some sort of legal status. Now, most of them don't support full citizenship, but they do support some sort of legal status, which is what we did here in Utah, and which is what should be done. And so I do believe that there is room for Republicans and Democrats alike to really work on this issue and to solve this issue, to bring people out from living in the shadows, to help fix the economic aspects of immigration as well, and to help especially those kids that have grown up here and have been born here. And so those are the types of principles that I've always believed in and that the state of Utah has exhibited. And so I think and I hope that the administration will be open to collaborating and working on these, and that's how we're going to get to a solution that most people can agree on.
Okay, we would like to take a question from one of our remote reporters. So Lisa with Deseret News, go ahead.
Thank you. Governor Cox, you said you're still very confident Utah can meet that end of May timeline for getting a vaccine to every Utahn who wants one. However, this week, President Biden said it's going to take until the end of July for that to happen nationally. There seems to be some concern that the Johnson & Johnson vaccine timeline for ramping up production and distribution may have been a little overly optimistic at first. They'll still get to the same number of doses, but it's going to take a little longer. Does Utah need to revise that timeline? Are you setting some unrealistic expectations here?
Well, again, we're just taking the information that's been given to us. And it was interesting. There were a lot of conflicting reports coming out of the Biden administration. The CDC director reported that vaccines would be available April, May timelines for anybody that wanted it. Dr. Scott Gottlieb has talked about how in April we're going to start having a demand problem more than a supply problem. And then we get these conflicting reports, some vague reports about maybe July. What we've learned from the Biden administration is they like to underpromise and overdeliver, and that's not a bad thing. I think lots of people, I mean, his goal was to have 100 million doses in 100 days, but we were already doing more than 1 million doses a day before he took office. So that's a very underwhelming goal. We will revise those timelines as we get hard data. We have not been given any of that. We are using the hard data that has been given to us from the very beginning, and so we're still very optimistic. And unless and until they tell us otherwise, and again, we met with them this week, and they were still very. I mean, this week in our meeting with the Biden administration, they were talking about the Johnson & Johnson vaccine as if it will receive its approval, and that they were still on course for their manufacturing deadlines. So, we'll revise them as they come. That's what we've done from the very beginning. But we're also far ahead of where people thought we would be, far ahead of the projections that were given in December and even into January. And so we feel very confident about that and where we are, and we'll continue to use those timelines until we're told otherwise.
Okay, Taylor with the Salt Lake Tribune, go ahead with your question.
Hi, Governor Cox. A bill passed through the House yesterday that would bar transgender girls from female sports. What is your position on that bill? And if it makes it through the Senate to your desk, will you sign it?
Thank you, Taylor. I will tell you that this is one of the most complicated and difficult bills that we have this session. And it's complicated and difficult for a couple reasons. The main reason that it's complicated and difficult is that both sides of this issue are actually right, and there's a lot of passion, a lot of fiery rhetoric, a lot of name calling on both sides of this issue that I think is very unfortunate. So look, there are biological advantages with your birth gender. Those are biological facts, and nobody disputes that at all. It is also a fact that women's sports has had a disadvantage for many, many years. We've gotten better, but we still have a ways to go. And so I want to say this. The bill's sponsor is coming from a genuine place of concern. And I don't think demonizing her or her intention is helpful at all. Because again, these are real, valid, serious concerns. And by the way, this is not a Utah issue. This is an issue that every state and every country is working through right now. I mean, at this moment, there is a group of women who have gotten together who are experts, and they're working. Martina Navratilova, others, Olympic medalists, PhDs, just over the past week, they've announced, or 2 weeks, that they're working on trying to figure out this issue because it is a threat to women's sports. But also, and this is where I think we have to be just so very careful, is that if you have not spent time with transgender youth, then I would encourage you to pause on this issue. We have so many people that are in a very, very difficult spot right now. And we have very few, if any, transgender girls that are participating in sports. We've gotten really good at the LGBTQ side of things. We're struggling on the T side of things. And we will work hard on this. I'm still working with the sponsor. We have a meeting today to see if we can figure out a Utah way to solve this issue. And we'll have more to come on that.
All right. Thank you, Governor. That's all the time we have for our broadcast portion of this show. To see this full conference, you can go to pbsutah.org, and we will see you back here next month. Okay, we would like to continue now streaming the conference so we can get to more questions. Do we have more questions in studio?
Governor, follow up on that last question. As it stands right now, then, would you sign it?
Let me apologize. First of all, I was getting the cutoff sign on that last one, and so I was trying to figure out how to wrap it up, and maybe didn't get to my full answer. I'm not in a place yet where I'm comfortable with the bill as it stands right now, and so these discussions are ongoing. We still have a lot of work to do. I'll just say I'm hopeful because. Again, and this group that I mentioned that has come together, they're very adamant, and I agree with them about kind of the rhetoric on both sides of this issue. Both sides are right and both sides are wrong, and this is one of those really, really difficult and nuanced issues that requires a level of understanding, a level of openness, and a level of trust that is missing from our political discourse today. But what I can tell you is in Utah we have a history. In fact, we've been celebrated. We've been well recognized of being able to figure out these difficult issues. And I'm not willing to give up on figuring out this one. I think there's still much that we can do to protect women's sports, and also to send a message to trans kids that there's a place for them and that they belong, and that's really important to me, that they know that. Look, these kids they're just trying to stay alive. there's a reason none of them are playing sports. And so I just think there's a better way. And I hope that there will be enough grace in our state to find a better solution. I don't understand all of this. I don't, but I'm trying to understand more. I'm trying to listen and learn, and again, trying to help kids figure out who they are and keep them alive. So I apologize for getting a little emotional, but when you spend time with these kids, it changes your heart in important ways, and so I want to try to improve that message and to see if we can't find a better way to work together.
Okay, John Reed with KUER, go ahead with your question.
Hi, Governor. So this is sort of related to we've been talking about, but there seems to be a conversation right now about how to teach students about race, sexuality, and some of those issues in school. There's sort of different sides saying that should be something that schools should be teaching kids. On the other side, parents say that's not something they want schools to focus on. And I'm curious, where you kind of fall on that, and whether you think schools should play a bigger role in teaching about, race, sexuality, and these other issues.
Thanks, John. You were cutting out a little bit, but I think I got the gist of the question. Yeah, this has always been an issue for generations about what we teach in school and who teaches it and what that looks like. We had a very unfortunate thing happen in the state where a charter school decided that they would not be teaching Black history, or they would allow kids to be excluded from that, which was a mistake, and a mistake that was corrected. And that's the unfortunate part, is that the narrative goes out and then the change was happened and nobody hears that change happened. And so there is a role for that. And it's important to be honest and open about our history. We've made mistakes as a country, and ignoring those mistakes doesn't make us stronger. I think what makes us stronger is confronting those mistakes and looking at the people who worked so hard to change those things, and who are continuing to work hard to improve and change those things. We don't have to do it in a way that denigrates people, but in a way that can build people. And so I think, again, just philosophically, there's absolutely a place for that. The piece on sexuality is a little bit different conversation, I think, but still an important one, and it's good to have the right kinds of information, including around sexuality. Now, I believe that that education at home is absolutely critical, and that we should be empowering families to have those conversations, and that parents matter, and that parents should have choices when it comes to who teaches their kids about these very intimate subjects that are so important, and sometimes have religious connotations, certainly have some moral implications, and what that means. And so I support families having that opportunity, but I also recognize that there are a whole bunch of families that aren't doing that and aren't having those conversations. And so we've been very fortunate in our country that teen pregnancies have been going down for a long time, including here in the state of Utah, and we want that to continue. Again, if you're anti-abortion, then you should be pro helping kids understand how to avoid teenage pregnancies and unwanted pregnancies, and so getting good information out there and giving families the option of how their kids get taught that, I think, is the right way to do it.
Okay, Chris with St. George News, go ahead with your question.
Thank you, Governor, and good morning. Turning back to COVID for a second, you mentioned it's not a good time to let up. Today, with the changes in the transmission index, areas like Garfield County here in southern Utah are going to have pretty much all restrictions lifted except for the mask mandate. Everything else is going to be, quote unquote, recommended at this point. How do you jive the idea of not letting up with basically a green light going on in at least eight or seven counties in the state?
Well, again, we should be celebrating excuse me, the change in the transmission index, because that means that that their percent positivity is really low. It means their case numbers are really low, and it means that their that the hospitalizations are coming down. Right, those are the metrics that we use for the transmission index, and so that is all good news. Now, the mask mandate is still in place, and that's when we say don't let up, that's exactly what we're talking about. Continue to wear masks. Continue to be very careful and about where you go and who you're around. Those are all things that we continue to recommend, and that certainly hasn't changed even in those low transmission areas. But this is good news, and it's a result of lots of different things. One, it's a result of people who have been careful, who have been safe. It's a result of more and more people getting vaccines and getting second doses of vaccines. I think I mentioned over 60, whatever the number was, 62%, I think, of those over the age of 70 have had their first doses. Over 15% now have had their second doses, and we know that you get some immunity after 10 days with the first dose, and of course after 10 to 14 days of the second dose, then you're very likely to have full immunity, at least 95% with the numbers we've seen through the trials. So there's that piece as well. We also have so much more testing, and this was the biggest problem early on in the, and not just early on, through the middle and even until really January, where we were not testing enough people and finding those who were infected and allowing them to quarantine so that they're not passing that around. And so these types of things were much more dangerous then than they are now. That being said, again, and people need to be self-selective too. If you're higher risk, then you should avoid some of these other activities, even with a mask. And people can make those decisions. People are really good at this. People have learned so much about pandemic. Everybody's an amateur epidemiologist now, and we can still make those. My parents, we're not in a low transmission area, but even if we were, they would still be very careful because my dad has half a lung, and I have a brother and sister with cystic fibrosis, and so even in a low transmission area, they're not going to be taking their masks off and going to restaurants and doing that type of behavior at all. So again, the transmission index is a way for us to measure spread in a community. And when risks are low, then it's okay for activity to pick up, and masks can mitigate that, especially good tight-fitting masks or double masking, N95 masks have the ability to mitigate that spread, even if you are in more of a congregate setting than you would otherwise be in.
Okay, Jacob with KSL.com, go ahead.
Good morning, Governor. Under the previous administration, under Governor Herbert, I think one of the main reasons that Governor Herbert, initially instituted some of the COVID restrictions we have now is to make sure our hospitals weren't overwhelmed. And now that we're seeing hospitalization rates start to go down, do you anticipate lifting or loosening some of those restrictions, or is herd immunity and vaccination still the main criteria you're looking at when you think about loosening those restrictions?
Yeah, thank you. So the transmission index is what it is, and that's what we're following now. So when you talk about those restrictions, there are very few restrictions. In fact, Utah has been recognized as one of the 5 states with the fewest restrictions in the nation. So unfortunately, we have some people that when they hear about lockdowns in California or other places, they're associating that with Utah, and it's just not true. But the transmission index is what governs those different, other than the mask mandate, everything else is governed by that document and those rates. So you're right, hospitalizations is one of those, but it's not the only one. And so you have to have more than that. Low case counts or a low positivity rate, and it's important to note how different those are. The hospitalization rate is a statewide metric, right? So that's something where we're protecting, and that's important because if you have serious COVID and you live in you live in Piute County, or you live in Wayne County, or you live somewhere else, you're not going to overwhelm the hospital there, right? You're going to end up at Utah Valley Hospital or in Salt Lake or St. George, you're going to end up in one of those hospitals. And so that statewide rate matters. And the good news is we are seeing decreases across the state ubiquitously. And that's great news. There's lots of questions about everything that's driving that. I think it's a combination of things. And so that's happening. And that will continue to guide us, that transmission index. When it looks to kind of getting rid of everything, then you're looking really on the vaccine side. There's been this argument, this kind of liberty argument, right, that we all make, and that is, do I have a duty to protect myself or do I have a duty to protect those around me? In a pandemic, and the way this disease works, we all have a duty to protect each other. That's just the way it works. And we have personal responsibility within that for sure. But there comes a time, right, when that changes now, and it's our responsibility to protect ourselves and not everyone else. And as vaccines become much more available, which again we're expecting to happen through April and into May, that's when we'll cross that threshold, right? Once you've had an opportunity to get a vaccine, then that's your responsibility. And if you choose not to do that, then you're taking on a risk, an unnecessary risk, but a risk nonetheless. And then we don't have, everyone else doesn't have an obligation to protect other people, because now everyone has a choice and a way to protect themselves. And so that's kind of how we're thinking, and those are the discussions we're having with the health department and legislators and others when it comes to removing the mask mandate. But if we continue to see cases fall like they are now, that's all going to happen sooner rather than later.
Okay, Ben Winslow with Fox 13, go ahead.
Hi there, Governor. Yes, I wanted to ask on the note of vaccines. There are bills up here on Capitol Hill that are in the works that would limit the ability for vaccines to be mandated, either by government, possibly by private industry, not having to require them. Does that hinder your efforts to try to reach herd immunity and to get people vaccinated?
Well, we're still having conversations about those bills directly, but I also want to be clear. It has never been the intention of government, nor will it, to mandate vaccinations. We believe, and we've seen the polling here in Utah. In fact, the last one I see, it's been a couple months now, but Utah was the second highest state when it came to people who said they were willing to get the vaccine, and at numbers that would put us really close to herd immunity. And no one can really tell you exactly what is necessary for herd immunity. It depends a lot on the virus and how many people have had it and how long that immunity lasts. There's a lot of things we don't know about this virus, but I'm very confident that again, vaccine supply being available, that we have enough people that really, really want this vaccine that will get us where we need to be. And so we will continue to encourage people to get this vaccine. We've got some media campaigns that are launching. We're going to be working especially in our multicultural communities where we've seen some vaccine hesitancy in the past to help get the right voices to help encourage them to get the vaccine as well. But I've never been interested in mandating vaccines.
Okay, we do have a question from Jed Bull with KSL. He would like to know when the state will implement high-throughput vaccination sites, meaning sites that can vaccinate lots of people in a short amount of time.
Yeah, so we have some of those high-throughput sites now. I mean, we have sites that are doing thousands of doses a day. And what we've done is we've put a metric in place that looks out over the next couple months and tries to guess, and then as we get closer in time, we get actual numbers, how many vaccines we will have available. And then we also have already started contracting with about a dozen different partners, vaccination partners, to be ready when those waves of vaccine come in, to make sure that we're always staying ahead. Our vaccination sites are always able to keep up with the supply as it comes into us, if that makes sense. And so we do have mass vaccination sites that we're working with right now, partners at stadiums, partners at movie theaters. So we've got kind of the big ones, and then some medium ones, some drive-through locations, some smaller ones in clinics, and out into different communities in their pharmacies. So we have all of these layers, but those high throughput sites, like some we have now, only on steroids, only much bigger, where we could do 5 or 10,000 doses a day or more, are going to be an important part of that. But we won't do that. There's no reason to do that when we're running out of vaccines every week. And again, so this will all be supply driven, but we do anticipate that going into March that we will be ramping up some of those bigger, March and certainly into April, some of those bigger vaccine sites.
Okay, Lindsay with the Associated Press, go ahead with your question.
Hi, Governor. I was hoping to ask you about another bill that would affect transgender youth. It would restrict the kinds of medical care they could get related to gender identity. If that one makes it to your desk, would you sign that one?
So the original bill we were opposed to, and it had many flaws. The latest iteration of the bill is closer to what medical standards are now, and I think that's really important. We actually had some conversations yesterday with Equality Utah and others on that very bill. I had threatened to veto that bill before, and so again, I think we have to be really careful. Anytime government gets in between doctors and families and patients. Right. We just had a discussion about not mandating vaccines, right? And you can see it's not much of a stretch to go from saying, that you can only get this type of medical care or you can't get this type of medical care to you have to get a vaccine and government's going to force that, or it's child abuse or something else if you don't, right? I think there's a line there, and I think it's a really important line. And so in our conversations with that community, they actually said that this latest iteration of the bill is much closer to something that may be acceptable with some other changes. So those discussions are still ongoing, and we'll see what a final version of that bill could look like.
Okay, any other questions in the studio?
Governor, we've seen some fairly measured police bills make their way through the session, but no sweeping changes. And after last year's summer of protests, do you think the legislature is doing enough to answer those demands for change?
Yeah, I really do. There's about 70 police bills, and I haven't been able to go through all of them yet. We're working on that this week to see kind of what's made its way through and what hasn't. But I think what you'll find is these are some really important changes, changes that will help in tremendous ways, changes that have been worked on by our multicultural community directly with law enforcement. And this is, when I talk about the Utah way and the way we do things, this is exactly what I'm talking about, where we make progress, where we make changes, where we help improve the environment of policing, where we help those in law enforcement to have better resources and to have better training, and we help to elevate those voices in our minority communities so that they're having those direct negotiations. And by the way, we've already implemented a whole bunch of this stuff without any legislation. And I want to commend Commissioner Anderson, who has been working very closely with the Multicultural Commission as well as the Martin Luther King Commission on some of these changes, and they've been doing direct trainings. It's been really incredible. We're also working on another project with our corrections folks. We have a new director of corrections, and we're implementing some really important empathy training. And the people that have gone through it already have said it's been life-changing for them. And so I'm really going to focus on what we're getting done and what we can get done. And I'm impressed with the legislature's willingness to address this, because I will tell you, there are a lot of states where none of this is happening, and they're meeting it head on and moving forward, and I commend them for that.
Right, but some police reform bills have stalled, like the bill to allow cities to establish police oversights board, or a bill to require body camera footage to be released within 10 days, and even a scaled-back version of no-knock warrants bill is stalled. So there are some places where the legislature doesn't seem willing. Are there any of those bills you'd want to see move forward?
Well, we're again, I don't know why those bills have stalled, and those are conversations that we'll have with leadership as we do our weekly meetings and talk through some of those things. Politics is the art of the possible, and sometimes we can move in leaps, sometimes we take smaller steps, but as long as we're moving in the right direction, I think that's what matters. And I really think that is what is happening. I never thought we would see this many bills or this many move forward and pass. And so we're going to continue to focus on those wins. And again, wins that are helping law enforcement. And this is where another issue where it's really easy to divide people, where there doesn't have to be a divide. It's a false choice. It's a false narrative. And in Utah, we're proving that it's a false narrative.
Okay, last question. Go ahead, Michael.
Just taking a step back, now that you've been governor for a month and a half, how does the reality compare to your expectations? Of course, you had a good idea being lieutenant governor, but what's been the most unexpected part of the job?
It's a great question, Michael, and I haven't allowed myself time to really reflect because it has been such an insane month and a half. I think the thing that surprises me the most is when I call people, they answer the phone. That didn't always happen before. And other governors, they've been fantastic. But it's pretty much what I expected. Having been so close to it, having worked so closely with my friend and mentor, Governor Herbert, I had a tremendous insight into what works. I will tell you, I don't know how governors that haven't had the experience that I've had, I don't know how they would do it. Being lieutenant governor was such an incredible training ground. I've got over 20,000 employees in this state, and I kind of know what all of them did already. I look at my friend Doug Ducey down in Arizona, who was running an ice cream company and became governor the next day. I don't know how he did it. I mean, he's done a tremendous job, but I would have been completely lost for months and months. But I feel so fortunate, and I feel so lucky to have Lieutenant Governor Henderson because her 8 years in the legislature, I only had 1 year in the legislature, which is more than most governors. We've had very few governors with legislative experience, but only having 1 year and having her 8 years, I mean, being able to hit the ground running, it's a steep learning curve, but I don't feel like we've missed too many beats, and especially in a pandemic. And I attribute that to my team. A transition is so hard. Forming a cabinet and getting the right people, doing it during a pandemic when we couldn't meet face to face. And we have a really good mix of people who have been here and new people, and they're working together. They're helping each other out. We actually had a training yesterday on how to deal with you guys. And it was awesome. You would have loved it. I think you would have really appreciated it. But there were some people who had never really talked to the press before, who are in important cabinet positions now. And then we have some that have dealt with the press and answering those types of questions. And we made sure to let them know that you're not the bad guys, that you're not the enemy. And it's so fun to see that mix of people helping each other out. And the new people are bringing a fresh set of eyes and saying, they're questioning everything, and we've encouraged that. We've said question everything, they come in and they say, why are we doing this? And too often the answer is, well, that's always the way we've done it. And they're like, well, what if we did it this way? And they're changing government, and it's really cool. And so I just want to give a shout out to my team and to the people of the state who have been so patient with us over the past month and a half. It's really been incredible. We don't sleep much, and we'll all be really, really glad, really glad when the legislative session is over. But it's been, I would say it's been better than expected, if I could put that final note on it. So thank you.
All right, ending in a positive note. Thank you so much for being here and answering all of our questions.
Thanks, everyone. Have a great day. Stay safe out there.